Hello, everyone.
Hello, everyone. How are you doing?
This is
Thank you.
Dr. Tabari Brittany Ledette. Thank you for joining us. This is now episode 7
Yep.
as we talk about some oral and health concerns during this lockout and count down my favorite songs of the 80s. Without further ado, let's get going. Unfortunately, as I said before, Facebook has prevented us from playing the songs.
Yeah.
But I will play a snippet of the songs in the edited version. After this live feed, I do edit. Have someone edit the show and put the snippet of the songs and the graphics and information that could be better understood rather than live. Okay, number 39, rock song called "Burning for You." The band is called Blue Oyster Cult. And I want to talk about kind of a mysterious oral problem. It's called burning mouth syndrome. Okay? Now, what happens is normally patients that have this sensation of burning mouth, 50% of them, you could find an identifiable source. Something's going on. Either they have an allergic reaction or some kind of iron deficiency or folic acid deficiency, or some kind of neuropathy because there's a chordotympanic nerve that's related to the lingual nerve that could cause a burning sensation. Sometimes some medications like proton pump inhibitors can cause it, or medical problems like xerostomia, which is caused by Sjogren's syndrome. Xerostomia means you don't have enough saliva. Your salivary glands don't make enough saliva, so that could cause it. Candidiasis, a fungal infection in the mouth. Lichen planus, people with HIV or AIDS, herpes, fissure tongue, multiple myeloma. These diseases can cause a burning mouth sensation.
Hi, Gabby.
However, a lot of time, 50% of the time, we don't have a cause, and nothing looks abnormal in the patient's mouth. And medically, there's no reason to explain it, and that's when it's a syndrome. There's no gross abnormal signs. Usually affects more women than men. It could be neuropsychogenic. A lot of times it is correlated with depression and anxiety. Some of the treatments, even though we don't have something we see or we can say it's doing this for sure, some of the treatments we could give are reassurance to the patient. We could give some anxiolytics like benzodiazepines to kind of calm what could be going on. Sometimes some anticonvulsants like gabapentin could be given, or antidepressants, notably the tricyclic antidepressants like nortriptyline. Could kind of possibly resolve the issue, but it's it's like a chronic pain problem that's hard to cure. But there are some therapies that hopefully will work for these individuals where there's no reason why they're having this. And a lot of times when you first see them, you try to make sure they're not deficient in some vitamins or minerals, like I said, folic acid deficiency, iron deficiency. So that's a little spiel on burning mouth syndrome related to the song "Burning for You" by Blue Oyster Cult. Moving on to number 39. Now that "Burning for You" is by Blue Oyster Cult. Mm-hmm. Now this band who sings this song is called just The Cult.
Oh.
Okay? They're a rock band from the 80s, and this song is called Edie. A lot of people might not know it. Hi, Sharon.
Hi.
All the way from Israel.
I know. Thank you for joining us.
Sharon works. He has a really cool job. He's my cousin. I love the guy, but he works for Mattel,
Oh, really?
the toy company.
Yeah, that's cool.
And so he sometimes travels here. And one I picked him up once at the airport by Mattel. There's a toys. That's awesome.
That is cool.
I need toys now. I have kids.
Yeah.
Send them away. Send them here. Anyhow, moving on. So Edie by the rock band, The Cult. Now, if anyone's familiar with The Cult, they were big in the mid to late 80s. Now, they have a very kind of a unique sound where they're a rock band. I play a doctor as well. They're a rock band that kind of didn't sound like glam rock, which was really popular at the time, and they kind of don't sound like grunge. They more have like a searing guitar sound. It's very, you'll know it when you listen to it, that it's a very distinctive sound. The guitar is searing, and a lot of their lyrics are kind of touch on issues, serious issues like suicide,
Oh, wow.
drugs, This one, Edie, is actually about the actress Edie Sedgwick. It was a little before my time and obviously before your time, but Edie Sedgwick had a tragic life and had a tragic death. She overdosed. But she was a model, an actress, and one of those Andy Warhol superstars that he had, because he had a bunch of short movies, and she was one of them. She's very culturally paramount. Like, there's a lot of music and ideas expressed about her. So it's about the life and death of Edie Sedgwick. And it's interesting because the lyrics are so poignant and yet tragic, but like there's a particular part, where it says the dogs lay at your feet, Edie. And then it says the wind caresses your cheek. Now you got to realize they're talking about her lying dead. The dogs are coming and sniffing her for the police. It's a crime scene.
Oh, wow.
But the lyric, the lyric, the wind caresses your cheek is kind of interesting, because when you say that, when they discuss that, it sounds like something like, oh, your life could have been so good, as something as so not nauseous as the wind caressing your cheek. But of course it's doing it when she's dead. So I think they implied that what could have been as her life, but it was cut short. It was tragic. Her whole life story was.
How old was she when she passed?
I think, I'm not sure. I was trying to look it up, but it couldn't have been past 30.
Oh, wow.
Maybe 28. If you want to research that. Edie Sedgwick. And the funny thing is, she came from a rich family too, and she did make it as a star. So I think that line is very, very prominent, as it says, the wind caress your cheek, where you think that's kind of like a good carefree thing, and you're so charmed, yet she's lying dead. So
Yeah.
little tidbit about me: when I first heard the song, because I didn't know all the lyrics, and I thought, I heard the lyrics very loosely, and I thought it was about a girl. I thought it was writing a song about a beautiful girl that pretty much had everything. She was beautiful, and she was like just had everything you could want in the world. That's what I originally, when I first heard it, and then when I came to discover it is about this tragic life of that pretty girl that could have had everything. So
Yeah. Deep. It's a very
it's a pretty deep song, and the Cult is they're a very distinct sound. Hi, Klaus Dieter Freemel. I hope I didn't mess up your name, but
Hi, thank you for joining us.
And moving on to number 37. You're not high on this group.
Hi, Yale. How are you?
Hi, yeah. You're not so high on this group.
Oh, really? Okay, who?
It's New Year's Day by U2.
Oh.
Okay.
But they're good.
Yeah, they're good, but you think they're overrated. That's because every time we try to, we're driving and we try to get something on our iPhones.
Yeah, they're all.
They pop up. I think that was
Yes.
a mistake for the group because they were already super famous.
That's what makes them annoying.
Yeah. And this is one of their, well, it's not their first song, but it's their first video on MTV. It's called New Year's Day by U2.
You too, Yale. Thank you. Nice to see you here. Thank
Yes.
you for joining us.
Thank you. And it's good that you joined us now because U2 New Year's Day, we're going to give a giveaway.
An 80s giveaway.
An 80s giveaway, as we always do. So tell them what they have to do.
So, because some of your profiles are private, we're not always able to see when you share our post. So, a new thing that I was thinking of is that you can just comment hi in the comment section, and then invite your friends and family to like it and like our actual Westwood Oral Surgery page. So
That's a great idea.
Our page.
Proud
yeah,
of you.
'cause-
Wow.
Okay, thank you. Like our page, like the post, and then just say hi in the comment section. Thank you,
Thank
yeah.
you. I tell you, I know you love this type of music. You post about this. Yeah, I know you love it. And okay, so hopefully maybe you'll win another prize. And this is the time capsule, just various things about the 80s from our 80s time capsule. And Brittany's gonna pick a present
With my eyes closed.
with the eyes closed, because.
Okay. Got
All
this.
right, okay, I just newly added that. Okay, so whoever wins, it's a poster of The Boss. Try to open it for you. Of Bruce Springsteen. It's an actual authentic poster.
Really?
Yeah, so it's kind of old.
What
But-
year?
It's 85.
85.
Of
Oh.
The Boss. Authentic poster of The Boss. I'll tell you what, whoever wins this, it is kind of old because it was up in my room, believe it or not. Okay? But it is authentic. Now, the thing is, it's a little beat up. I just added this. But whoever wins this, I'm going to laminate it and send it to you.
Oh, that's gonna be nice.
Yeah, so I'll spend some extra dough and laminate it because I like laminated things. And I will send it to you. So it might take a little time, whoever wins this. Yeah, if you win it, I want this up in your daughter's room. Yeah. Okay, very good. All right. Moving on to number 36. Okay. Number 36, another metal song. It's Photograph by a group called Def Leppard. They're famous in the 80s. Okay. Def Leppard is an amazing band because you got to realize their drummer had a tragic accident right in the middle of their heyday and lost an arm. The drummer losing an arm. So, long story short, basically he learned to play the drums with one. Well, he knew how to play the drums, but he managed to play the drums with one arm.
Wow.
And then they had this second phase of stardom. This is from the Photograph is from '83, but then they went on and dominated the late '80s too. After while he was performing with one arm as a drummer, so
Wow.
amazing, incredible story. Anyhow, yes, Love Bites. That was earlier in our countdown.
Yeah, that was.
Anyhow, Photograph, I want to talk about a stud.
Okay.
Right now I'm going to talk about a stud, a British man by the name of Hounsfield. Okay, and since we're on the subject of Photograph, Hounsfield, I'll put a picture of him up on the edited version, but he's a stud because he helped develop the CT scan.
Oh, okay.
Okay,
Mm-hmm.
and because of him, through many years of his work, very humble guy too. If you ever see his interviews, Hounsfield, and because of him, we have the CT scan. First made available in the U.S. in 1972. He won the Nobel Peace Prize in 1979. Uh, Englishman. Now I want to tell you something. Something. I think it's kind of interesting.
Okay.
Okay, people bag about religious people eating certain foods or not eating certain foods, but there's a little rhyme and reason now. I'm Jewish. I'm not religious, and I guess naturally I'm kosher because I'm a vegetarian. But here's the thing. So before CTs, obviously there were X-rays. Now X-rays served great in the medical community, but there was a problem with it. If you take an X-ray of something, you're going to get overlap. So let's say we took an X-ray of you at a particular part of you, and you get the X-ray beams. They go through you, and are you a vegetarian too? That explains a lot. I'll tell you later. Okay, so an X-ray beam goes through you, and it comes to the plate where the X-ray develops. Okay? What the problem with that is, there's a lot of overlap because usually X-rays get bone, mainly they get bone, and so there's overlap of bone.
Okay.
So while X-rays were good for things like the chest, since you were 12, so 3 years ago. X-rays were good for things like the chest and the bones lower under your head and brain and neck area.
Okay.
But there was a problem, is that you couldn't see everything. You just saw overlap of images, and they had a problem because they wanted to see mainly the brain initially.
Okay.
And the brain is encapsulated by a bony skull, which creates a lot of overlap, and you can't really see. When you're taking an X-ray of the brain, you just see the skull, you don't see what's inside of it. At any rate, while this Hounsfield was going about and trying to make the CT happen, they had to do experiments, and they were trying to capture the image of a brain. And of course, they don't use human brains, they use cow brains as experiment. Cows that had died, and then they took their brains and they put them in a bony vessel and tried to experiment on their CTs.
Okay.
Now here's the problem, and here's where it gets a little interesting. They did that from a slaughterhouse, the brains from the cows from a slaughterhouse. But it didn't work because the brains were necrosed and dead, and for some reason the brains were flabby and didn't So they had to go to a kosher slaughterhouse, because if anyone's familiar with this, if an animal is killed in a kosher way, they do it in such a way where they take a sharp knife and they do one slice where they cut the bilateral carotid arteries and the jugular veins, but they leave the spinal cord intact, and they do it in a very precise manner as to kind of save the animal from pain and kind of have the animal bleed out in a proper way.
Oh, okay, I get it.
And they weren't doing it for the reason of preserving their brains for testing, but they did it for the reason of there's a whole 5-technique ritual on how you're supposed to do it.
Right.
But what that did with the brain is it left it pretty intact, because it didn't have time to get necrosed and lose its shape.
Yes.
Okay.
It is. Yeah.
It is horrible, and if you're disgusted by all this, just don't eat meat like I do. I don't eat meat. But anyhow, the point of being is, it's interesting because there is actually rhyme and reason if someone keeps kosher or not. There is a difference. It's proven at that time, at least, while he was doing his experiments, because he had to go to kosher slaughterhouses to get the brains. Because regular slaughterhouses, the brains would be all
yeah.
Exactly.
Oh, wow.
So
very interesting.
Little tidbit on Hounsfield based on the song "Photograph" by no fish, no meat, no chicken. Exactly. I gave up fish about a year ago. I was originally pescatarian.
Pescatarian.
Pescatarian, yeah. So, and it's fine. It's really easy for me. I'm sure it's probably easy for you. I know you're in great shape. I have to do more, but anyhow, let's move on to number 35, and everyone will know it's this song because it's transcendent through time, and it's "Eye of the Tiger" by Survivor. You know, of course, everyone remember this song, the theme song from Rocky. And I want to talk a little bit about an eye issue, and the eye issue is called glaucoma. Okay, so of course I'll have better pictures up on the edit. This is your eyeball, and yes, Rocky. If you go to Philadelphia, this aside, there's three things that rule the city of Philadelphia, and I went there for dental school. But so I spent 4 years there. There's three things, and the great Payman doctor told me this because he lived there for a year before I went there. And when I moved there, he helped me, and he said there's three things that rule this town. One are the Philadelphia Eagles.
Okay.
Two is Benjamin Franklin. There's Benjamin Franklin bridges, signs everywhere.
Okay.
And three is Rocky. You'll hear the soundtrack. Everything is based on it.
On Rocky?
Yeah, the movie Rocky. It was because Rocky was based in Philadelphia. Anyhow, this is the eye, okay? And what glaucoma is increased intraocular pressure of the eye, okay? Kind of going further, giving a close-up of the eye in the front of it. This is a little confusing. This is the front of the eye. It contains two chambers. There's the anterior chamber and the posterior chamber, okay? And they are demarcated by this thing called the iris. That's the color of your eye. Well, it's actually also a muscle that releases fluid and separates the posterior chamber of your eye to the anterior chamber of your eye. Now, the fluid in your eye that's made from the ciliary bodies above the iris, they travel to the anterior chamber, and then, they travel from the posterior chamber and they go to the anterior chamber, and then they get sent through this canal called the canal of Schlemm, which kind of dives off the body, receives the fluid. The problem is that canal of Schlemm could sometimes get blocked. And if it gets blocked, you have obstruction and you have fluid buildup. The fluid in the anterior chamber is called aqueous humor. And that fluid buildup can create hypertension, increased pressure for the eye, and damage the surrounding tissues of the eye and the lens, and create a high intraocular pressure. So that is what glaucoma, basically the pathophysiology of glaucoma. Now, how do we treat it? We could give some medications to decrease that pressure, decrease the outflow of that aqueous humor from the glands in the eye, or we could give medications to increase the taking of the pressure from the canal of Schlemm, okay, the uptake of the fluid. Also, there's procedures called trabeculoplasty, which opens this meshwork, kind of opens the canal that's obstructed. Of course, ophthalmologists do this microscopically. And there is actually another procedure called iridotomy, which pokes a hole in the actual iris so the fluid doesn't build up. Okay? Now, one other thing is that there's two mainly different types of glaucoma. One is open angle glaucoma, and that's when the iris is kind of normal. It's not obstructing the fluid. You could still have glaucoma, but it's not because of the iris creating a very narrow angle. If the iris does do that, that's called narrow angle glaucoma or closed glaucoma. And those are the two different types. But don't take my word on this because I'm not an ophthalmologist. I do know of a great ophthalmologist. His name is Ebi Saruti. He's popular, and he not only is an ophthalmologist, he's had fellowships in oculoplastics and retinal detachments. I don't get sponsors. Okay, I know we're not that big to get sponsors. I just know him, and he doesn't even know I'm doing this. But I just know him throughout childhood, or
Where is
college.
he located? His office?
His office is in Westwood. He's got one in Huntington Park. I'll put up his information in the edited version. Ebi Saruti. But he also has, the guy's invented something called iPress, I think, that you can find in CVS or Thrifty. Just kidding.
Old
Thrifty,
school.
yeah. CVS or Rite Aid, Walgreens, iPress to treat styes that you get in your eyes.
Oh, wow, that's cool.
Now I remember him in college when dinosaurs were roaming the earth. When I was in college with him, he was like a double major. He was like a bio major because he was trying to get into med school, and he did. But he was also, he loved engineering, so he had this major which was about how to make machines for medicine.
Oh.
Like how to make, probably X-ray machines or things like that. Things at that time which I still have no clue about, but like that was kind of
That is cool.
so
Very interesting.
yeah. So Ebi Saruti, I'll put his information up, and if you have any eye problems, he's the go-to guy. Girls tell me he's good looking too, but that's an aside. Another thing about it, he's married to a dentist.
That's always good.
Okay, where are we? 34. Everyone that knows me by now knows how much I love this singer, and it's probably her biggest song. This is Self-Control by Laura Branigan. Na 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 na. You love that song.
I do.
I want to talk a little bit about self-control, and unfortunately, there is a common disease that mainly women suffer from. Women ages 30 to 60. It's called hyperthyroidism. Awesome, Yael. Unfortunately, she passed away. Laura Branigan, at a young age from breast cancer. However, I want to talk about hyperthyroidism, and that is basically the overproduction of thyroid hormones. So let's start this out. You have your thyroid gland, okay, which is your cricoid thyroid cartilage, okay, and your cricoid area. Now, what happens is in the brain, there's an area called the hypothalamus. This is the base, the area of the brain that's the hypothalamus, and it attaches to the pituitary. The hypothalamus, based on need, releases this hormone called thyroid releasing hormone. That thyroid releasing hormone travels to the pituitary through these blood vessels, and then the pituitary gland reacts by sending a hormone called thyroid stimulating hormone. The thyroid stimulating hormone then goes and travels to the thyroid. Okay? Once at the region of the thyroid, it stimulates the thyroid cells to make hormones called thyroid hormones, which are T3 and T4. You don't need to know the main names. But there are T3 and T4, the thyroid hormones then get released to the body where they control a lot of metabolic functions. T3 and T4, to make them in the thyroid, you need iodine, and it's made from iodine, combination of iodine and this molecule called thyroglobulin. At any rate, thyroid hormones control a lot of metabolic processes, but when they go haywire and you have a lot of thyroid hormones circulating in your body, you can have a lot of signs and symptoms. One being goiter, which you have an enlarged thyroid gland, and sometimes you could see it and it's pretty pronounced. You could get tremors, anxiety, heart palpitations, sweating, heat intolerance. A lot of women that are in their middle ages, they tell me, I feel so hot where the room isn't normal temperature. That's something that, get the light in the brain turned on for that. Weight loss, frequent bowel movements, exophthalmos, scientific name for meaning your eyeballs are a little bit out,
Bulgy.
bulgy, exactly, bulgy eyeballs. That's because, distinctly this causes some mixed edema, meaning some sugar molecules are entrapped in the eye muscles behind the eye, and that kind of bulges the eye out. So what kind of causes some of these problems? What causes your thyroid hormones to go whack? Some of the most of it is from this disease called Graves' disease. I would not call a disease Graves' disease. That's just ominous, but a lot of people live with it, so it's not. Prognosis is, it's good. But Graves' disease is an autoimmune disease where, I'll blow this up, but you have basically autoimmunity. You have immune cells that are acting like that thyroid stimulating hormone on the thyroid cell, and they're acting like the thyroid stimulating hormone. They're causing the thyroid gland to release more of the T3 and T4. It's the most common cause of hyperthyroidism. Then you have other things like if you intake too much iodine, or something called toxic adenoma, which is the thyroid releasing hormone kind of being mutated and acting inappropriately, acting too much. And then you have other rare things like pituitary hormones. Remember, I told you that the pituitary releases thyroid stimulating hormone. It's one of the, the whole pathway to this thing. And sometimes you have tumors of the pituitary gland. Interesting thing, personally, is, I don't do this anymore, but in residency, this was really cool and interesting. For us as oral and maxillofacial surgeons in residency, the neurosurgeons would ask us when someone had a pituitary tumor and they needed to remove part of their pituitary, they would ask us to gain access to the pituitary through the mouth. So it was really a like amazing experience where you could actually, through the upper lip and going inward under your nose, you could reach the base of the skull, and they could get access to the pituitary gland. It was great. I love residency.
I bet. That sounds fun.
Also, pregnant ladies, when human chorionic gonadotropin hormone is released when they're pregnant, that could stimulate the thyroid to make more thyroid hormones. But the good news in all this is there's treatment. There's drugs. 2 drugs come to mind: propylthiouracil and methimazole are drugs that inhibit. They're antagonists to the thyroid hormone. Also, you can have radiation iodine therapy, and you can have surgery. So there's ways to control your hyperthyroidism. Then again, a lot of women have the reverse. They have hypothyroidism, which is the reverse, and that's where you see the reverse signs like cold intolerance, weight gain.
So everything is just the complete opposite.
Pretty much the signs and symptoms, yeah.
That's interesting.
And, I bring this up because it does affect a lot of women.
Is it something that you don't know? Like, is it something that's kind of hard to diagnose, or is it pretty? No,
it's easy. Endocrinologists, I think they've done a good job, and where it's a lot of people have it, but it's managed. For instance, my mother had hyperthyroidism, but it's managed. And you have a lot of women, especially after age 30, that are on a lot of drugs, like Synthroid is and you're hypothyroid. Or a lot of these drugs like propylthiouracil to control the thyroid hormones if it's too much. So I think it's managed. You could also get iodine radiation treatment. So it is prevalent. This is highly prevalent, but it's managed well. And I think the endocrinologists are doing a very good job, and the medicines are there.
That's good.
So yeah, it's good. So if you are a woman and have those symptoms, maybe you have it, and it could be, treated. So it's just, advances in modern medicine. It's great. Anyhow, let's move on. A lot of information in this.
Yeah, this one was kind of packed
Yes.
with information. Good though.
Number 33 is a song called Harden My Heart by a band called Quarter Flash. In my opinion, they were very underrated, and Quarter Flash's lead singer is the great Randy Ross.
Okay.
And the way she sings and also the way she looks, I thought she was very attractive. It's kind of like that girl, that girl that you did bad to, and then you see her at a party and your jaw drops
And you go,
and your heart melts. That's if you ever look up Randy Ross from back then, and the way she sings is totally congruent with that. And this is Harden My Heart. Want to talk about, the song's called Harden My Heart, but I want to talk about hardening of the arteries of the heart. And that's a common disease called atherosclerosis, where plaques form in the coronary arteries that supply blood to your heart. I'll put better I hit you, sorry.
It's okay.
I'll put better pictures up in the edit. So what happens is what's going on is obviously your heart is like an organ, it's tissue, it's cells, it needs blood supply to keep it vital, and it has a coronary blood supply. I discussed this before in previous episodes. And atherosclerosis is when plaque develops. Now, some of the components of this plaque are cholesterol, fibrous cells, something called foam cells, and blood clotting. And the key here is the cholesterol. That's what we want to control. That's what, because we don't want cholesterol to build up. If we have high cholesterol, we're worried about this, from getting a good wide open coronary artery to build up of this cholesterol and plaque buildup, where it could lead to a clot and cause ischemia, meaning lack of blood supply to the heart muscle. A little bit on it, transient ischemia means there's lack of blood to the heart muscle for a period of time, usually 10 seconds. However, if that lack of blood supply lasts for about 30 to 45 minutes, then it's a full fulminant myocardial infarction. Okay? Where, initially when the blood supply is limited to the heart muscle, you get a buildup of lactic acid, you get a higher amount of protons, you get lower pH, and you get tissue injury, which at some point is reversible, but at some point, if it lasts long, it's not reversible. And that tissue injury in that affected part of the heart could affect the wall motion of the heart, could create irregular contractions, could decrease the force of contraction, basically decrease how the heart works, and you have problems because you need the heart to send blood all over your body. Okay? So what a lot of doctors try to do is lower the cholesterol, obviously, and there's lab tests for it. Now, one little confusing, I always had confusion with this. I recently, I've figured it out, is they talk about two different types of lipoproteins. There's low density lipoproteins and there are high density lipoproteins. And why that's always been confusing to me is because the low density lipoproteins, bad cholesterol. High density lipoproteins, good cholesterol. Lipoproteins are basically carriers, they're protein and fat, and they're carriers of lipids. But when you have low density lipoproteins, the name is a little confusing. It's low density, but it contains a lot of fat. It's low density because it contains low protein, but a lot of fat. So that's why it's called low density, indicating the protein that's carrying the fat, but it has a lot of fat. High density has little fat, lot of protein.
Protein.
Okay, little simple drawing. Of course, I'll make the drawings better, but the red is fat. If the red was fat, you could see that's LDL. There's a lot of fat. The blue is protein, little
bit of
protein. HDL, little reverse. There's little of that red. There's more of that blue protein. And these are carriers of lipid to the liver. So HDL good, LDL bad, and those are lab tests that they do to see how your cholesterol is. Of course, in addition to your total cholesterol measure. Okay? So
Very
that's
good.
yeah, that's 33, and we are coming up on 32. We talked about this. This 32 is a song called "Home Sweet Home" by Motley Crue. You saw the move on that,
yeah, I did.
Dirt. Home Sweet Home, yeah, Motley Crue is a metal band. They're known for a lot of their vices and a lot of their excesses. And as you saw in that movie, Dirt. Of course, I knew that before the movie, but it was still entertaining. And this song, however, is different. It's not a rock so much. It's a ballad song. It's a power ballad where they're actually talking about being homesick when they were traveling on the road, and the angst of being on the road for so long. And this song is about that. Because, you could get tired of sex, drugs, and rock and roll. It could be very tiring. So they wrote a song, Home Sweet Home. And recently I just found out that they, because of coronavirus and all that, and that we have to be staying home, they released a lyrical video of that song to
like
for this generation, like a video that shows the lyrics of the song, that to help their fans cope with staying home.
right now.
Yeah.
That was cool.
So yeah, and this is 32. Okay, let's move on to number 31. German band. This song is called "Forever Young." A German band called Alphaville, and actually they're a great band. They have another
a great song.
Yeah, you know this song.
I do.
You young one.
That's kind of like a timeless song,
That is a timeless song, and it's great because it also has this trumpet like delivery in the song that's na 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 na. And they're smart because they released a slow version of the song, which is the main song, but then not too much longer they released like a dance version.
Oh, that's cool.
Yeah, so Alphaville, Forever Young, and I want to kind of dedicate this song. The song talks about the threat of nuclear war, which was prevalent in the 80s, but I want to talk about Kobe Bryant.
Okay.
It seems like so long ago, but it's less than 8 months ago when Kobe Bryant died in the helicopter crash that also took 8 others' lives.
I think it feels like that just because of everything
that's happened,
like
the
with
coronavirus, civil unrest,
makes time feels like it's speeding up, but going slow at the same time.
Exactly. It seems like a lifetime ago. Yeah, exactly. Like, I can't believe, time's going.
Like
we're almost at the end of summer. Yet,
I know, yeah.
Yet you go back and he died January 26th of 2020, and it seems so long ago, which is kind of weird. But this is dedicated to Kobe Bryant, and in our minds, he'll always be young because he never got to be old. He died young.
Young, yeah.
And of course, dedicated to the other people that lost their lives in that horrible helicopter crash. That's funny though, because the thing is, we'll remember Kobe as always being forever young. Now, you're too young for this, but when Kobe and Shaq were on the same team, they had their little squabbles, and the press were writing stories, and they were comparing them, and they were saying, there's such different kind of people, because Shaq is like funny, he's comical, he's not too serious, and he acts 10 years younger than his age. And then they said Kobe, he's
more like serious,
dedicated, Mamba mentality, he acts 10 years older than his age. And it's just ironic that we'll always remember Kobe
For being forever
young.
young.
Yeah,
Yeah,
well,
that is
he won't get old.
interesting.
Yeah, forever young. And then Shaq, hopefully he'll live forever, and we'll see him. He's
Progress,
bald, so we
yeah.
can't see gray hair, but might see gray. So that's a little interesting, the
That
way
is
the
a
world
good one.
worked.
Yeah.
And just dedicating that song to him, and I hope his family's having an easy time now. I mean, unfortunately, horrible thing that happened.
Yeah.
But if you're in the LA area and you were then, it's changed now. But in that month, up until the lockdown, there were so many murals for
Yeah.
Kobe and paintings. I mean, this town was enthralled.
Yep.
Any rate, he'll be forever young. And another thing, I think people, I remember when he first was a rookie. So I followed pretty much his whole career. I was a big sports fan. Now people initially didn't like him because of he's serious. He's very. But I think as his career went and it was towards the end, they started to love that because they had that that Mamba mentality where you're giving it
They
all.
appreciated like
appreciated that.
his hard work, his
Yeah,
craft.
exactly. Where initially he seemed like standoffish and
Yeah.
maybe a little egotistical, but after that they realized that it was the ingrainment in him to like give it all.
Yeah, exactly.
Okay, now we are on our last song.
Are we gonna do another giveaway?
Of course we're gonna do another giveaway, but
Okay.
let's do the giveaway. And well, the song is, you mentioned this because you talked to me about it, but it's Every Day is Like Sunday by Morrissey. Used to be the lead singer of the Smiths. Now, Every Day is Like Sunday if you hear the lyrics, it's all doom and gloom, depression, and it mentions Armageddon. So you talked about Armageddon with me, so I just wanted to point that out.
That
And
actually is a good song.
yeah, and then Every Day's like doom and gloom lyrically, but it's actually a sing-along song. So, and then the funny thing is, it's a sing-along, but it's not uplifting by any stretch of the imagination. You take the same lyrics, which Natalie Merchant from the 10,000 Maniacs did, and a couple of years later, she remade the song in a more upswing of the song. And it's just funny because the song, the way she sings it, sounds totally like cheery and joyful. And she's singing the lyrics of like
She just
doom
put
and
a twist,
gloom.
a serious twist.
Yeah,
on it.
really, yeah. So, just a FYI. But now let's do our giveaway from the time capsule as we end the show. Okay, tell me what you have to do one more time.
So you have to like this live post, comment in the comment section saying hi, and then like our Westwood Oral Surgery Facebook page.
Yes. Okay. And let's see.
Alrighty, let's see. I'm gonna try to go to the bottom. Oh, looks like a cassette.
Oh, okay.
Oh, Tron.
Tron VHS video cassette. Okay.
VHS, what's that?
Yeah. So yeah, this is a Tron VHS video cassette. For whoever does those things, I'll send this to you. Look at that. Look at that.
So cool.
This is, you had a piece of something.
I know.
It was, now it's streaming. What on earth
I
is
know.
it's going in cyberspace?
No one will ever know,
Yeah,
the
this is a
struggle
piece
of
something.
rewinding it too much,
yeah.
huh? And it showing those little waves after a while.
Yes. Okay. Thank you very much for joining us. Winners, you will get your prizes in due time. And keep rocking to the 80s.
Thank you guys. Bye.